All righty, now we have our panel guest speakers. And I would like to present to you Dr. John Farley, whose bio I will read first.
So you're going to put the camera down there.
Dr. Farley practices internal medicine and infectious diseases. He was provincial epidemiologist at the British Columbia Centre for Disease Control, where he spearheaded a campaign to have grade 6 students within the province vaccinated against hepatitis B. You were one of those, Kayla. This was the beginning of the universal hepatitis B vaccine program. Dr. Farley worked with the World Health Organization on HIV/AIDS in the Caribbean region and was Chief HIV/AIDS Surveillance at Health Canada. He is currently Infectious Diseases Consultant for the Pacific region for Correctional Services Canada. Dr. Farley has his own private clinics in Vancouver and Abbotsford, where he treats patients with infectious diseases such as hepatitis and HIV. He has done tremendous work helping those in Vancouver's downtown east side and also those within and outside the prison system, raising awareness and in prevention and treatment of hepatitis B and C and co-infection with HIV/AIDS. He has a number of publications in his areas of specialty. Dr. John Farley.
Thank you very much for the introduction, Petra, and thank you very much for asking me to participate here this afternoon. I can say how very impressed I am with what you've done. I was in Abbotsford yesterday, and I can tell you that unfortunately the mayor and town council feel that there's no place for hepatitis C education, harm reduction methods in Abbotsford, because I guess it doesn't happen. So it's so very enlightening.
Bible Belt.
It's so very enlightening to know that the effort that you're taking here in spearheading the work, and I was just learning of some of the work you're doing in the clinic, because I can tell you from my experience, it's going to take everyone and the effort of everyone in the area of prevention, in the area of treatment, and specifically in the area of advocacy. It's unfortunate that we do have the significant problem we have with hepatitis C today, because unfortunately, while we have a cure, BC, as we heard from the figures that were quoted, in Canada we have an estimated 300 people with chronic hepatitis C virus infection, probably about 600,000 who have not been yet diagnosed or know their status. In British Columbia, it's estimated that there are about 60,000 people with hepatitis C virus infection. And unfortunately, despite this problem, our Minister of Health 2 years ago felt that we did not have a hepatitis C epidemic, and we do have a policy whereby they're treating they're funding treatment for 1,000 people per year. And that's how we expect to get a hold of this problem. Hepatitis C has been around for a very long time. There are about 123 to 170 million people worldwide with the virus. And some of us may remember that it was classified as non-A, non-B hepatitis. That was around 1974, when people were figuring out there was a hepatitis that was neither A nor B. In the United States, the Red Cross then, they decided to take a step towards screening blood. In Canada, it was felt that it was not that significant a problem, and therefore the blood was not going to be screened. And needless to say, between 1985-86 and when the test was finally diagnosed, a needless number of people were infected simply because some of us felt, some of our professionals as well felt, that it was not worth the extra $20 million it was going to cost to screen the blood. We're facing the same problems today. We have about anywhere from 30 to 60,000 people who are infected. We have relatively highest proportion of residents who have chronic hepatitis C virus in the country. British Columbia ranks first, and Ontario ranks second. Almost double the national rate, that's about 60 per 100,000 population for British Columbia. Yet, British Columbia and Ontario are the two provinces with the most restrictive criteria for enabling people to be treated. We have, unfortunately, ourselves to blame. When I say ourselves, lots of our professionals who, when we speak to the minister and say we have an epidemic, who feel that we do not have an epidemic, and who can justify why people who have relatively mild disease and people who do not have mild disease, but criteria based on normal, so-called normal liver enzymes, should not be treated. The history of the disease is such that a person, as we heard a little earlier, may be infected, and unless one is tested, you would never know that you have the disease until the symptoms manifest themselves, which tend to be very late. About 15 to 30% of people would clear the virus on their own. Another reason for testing and doing very specific testing, because if a person is exposed to the virus, there's about a 15 to 30% likelihood that your own immune system you will get rid of the virus with. And in my practice, it's unfortunate how many people are still walking around thinking they've got hepatitis C virus when they have not been adequately tested. And part of this has been an uphill battle to try to get the ministry to fund the testing to diagnose whether the disease is active or not. Of the 70 to 80% of people who have the chronic disease or who have not cleared it on their own, about 30% will go on to develop end-stage liver disease. And this usually manifests itself by cirrhosis, which can take anywhere from 15 to 30 years to develop. As such, unless one is tested and unless one looks for the disease, one may never identify it until one comes with symptoms. Of those who develop cirrhosis, about 1 to 4%, 1 to 5% probably, will go on to develop liver cancer, 1 to 5% per year. The sad fact is that this does not need to happen. We know that there is a treatment that's available. Over the last decade, there have been marked improvements in the management of chronic hepatitis C virus infection. There are new treatments available, the pegylated interferon and some pills called ribavirin. And if they're taken together, then the chances of a cure, and I can use the word cure, are very high. Absolutely, it's cure, because I can tell you, there are so many days, and I've got a few hugs when I've been able to tell my patients you're cured, because they never realized that there was a word called cure for hepatitis C virus infection.